You're listening to the Doc Lounge podcast. This is a place for candid conversations with the healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment. I am one of your hosts, Cameron Steinheimer, and I am the marketing manager here at Pacific Companies.
Hello and welcome everybody to the Doc Lounge podcast by Pacific Companies. I'm your host, Stacey Doyle, Senior Director of Marketing. I want to thank you all for tuning into our Provider's Perspective series. This series focuses on a physician's journey through medicine and the learnings and advice they would give to their peers and upcoming physicians. Our special guest today on the Provider's Perspective is Dr. Sylvia Gray, a hand and plastic surgeon. Dr. Gray is the Department Chair of Surgical Specialties and Section Chair of Plastic Hand Pain, ENT, and Orthopedics at Mercy in Oklahoma. And I'm also joined by my co-host, who is Callie Keeney. She's the Business Development Consultant at Pacific Companies. I want to welcome you both to the podcast.
Thank you, Stacey, for having us on.
Happy to be here.
And I would love to learn a little bit more about you guys' connection and how you both came to know each other.
Well, it's a good story, and so I feel like we tell it not infrequently. People always wonder why I am in Oklahoma, and I was born in Bolivia, and I grew up in Kentucky. I did my training all over the place in Boston, Houston, and I was last in Miami for my hand fellowship. And when I was looking for a job, I had done a plastic surgery residency and orthopedic hand fellowship, and I wanted to do a lot of both. And oftentimes you can go into hand surgery as an orthopedic resident or as a plastic surgery resident. And then when you come out, there's jobs within like orthopedic groups that you can do a lot of hand. It's difficult to do plastic surgery within that kind of setup. And then there's other jobs. Plastic surgeons, about 60% of plastic surgeons go into solo private practices, and they just do a lot of plastic surgery, but it's hard to do hand surgery in that setup. And so when I was looking, I looked all over, and Callie she was at the time a recruiter for Mercy, Oklahoma. And she had, I think I found a posting for you, and I called you and I said, hey, tell me about the job. And so she told me it was a hand surgery job, but I was like, I really want a good mix of things. And she said, okay, I'm going to make that happen. And so she, at the time, the president of our Oklahoma hospital was a general surgeon, and he just was he was like a visionary. He said, you know what, if this is what you want to do, we can figure it out. We've never had a plastic surgeon, but we can figure it out. And I said, okay. So I came up here and interviewed.
You said, okay, great. By the way, I'm 9 months pregnant and I need to interview in 1 week. And I said, okay, we'll make that happen.
Yeah. So I could only fly until 37 weeks. And so I had 1 week to be here. And I was very pregnant, like very, very pregnant. And so I didn't want to catch anyone off by surprise. Like there was no hiding that was the case. So it was February.
Mm-hmm.
And I had been in this Miami weather that, and I had no winter clothes, none that fit especially.
Yeah.
And so she picks me up and I was like, wow, it's cold here.
Not only was it cold, I believe we were under a blizzard warning, which I swear never happens here in Oklahoma. It's very, very rare. But of course, the day my candidate from Miami was in town, we happened to be having a actual blizzard. We had to pull over multiple times as we were driving around for her site visit and community tour because the windshield wipers kept freezing to the windshield, and I'd have to get out, scrape them off. And I thought, there's actually no way this brilliant woman from Miami is going to come after seeing this. But
I mean, I think the job, and I mean, Callie was obviously a very good recruiter. And, I think the fact that I could do what I wanted was the selling point, and the rest could, get figured out. And it's held true to this day. I've gotten to kind of shape my practice exactly how I want it. And I think and that's why I've stayed for so long. I'm here coming up on 10 years. It's my first job out of fellowship. And I think the thing that people talk about when they talk about burnout, or when they talk about not having good job satisfaction, is not having much control of what your life and what your job looks like. And that has been the opposite. I think I've had a lot of say in what my job looks like throughout this time, which keeps you motivated.
And that's a testament to the leadership here at Mercy and the administration, who followed through on the promises they made to you during the recruitment process and continue to involve their physicians in leadership roles. And it's worked out.
Yeah.
And now our kids are on the same sports teams, and we hang out together all the time. So
yeah,
I'm very glad she's
from that day of horrible weather, friendship was formed.
That's right.
And it sounds like really a real partnership between, a recruiter from an amazing health organization like Mercy, and a physician like yourself. And I think, Dr. Gray, hearing you speak, it is really powerful for our listeners, because you use the power of what you wanted and knew that, hey, this is something that, would be the perfect, dynamic for me in my career. Let me go ahead and ask and see if this is something that can happen. What kind of gave you that, courage or that strength to follow through with what would really make you most happy?
Well, I mean, I think it was mostly that at the time, we do so much training. You're doing 6 years of plastic surgery residency and then a year to specialize. And I didn't feel ready to say, well, I'm just going to give up, this much of my training and be super focused. And, some people know that ahead of time, which is great. And I really just wanted a very broad practice. And I think that now on this end of things, I've been able to recruit 2 other plastic hand surgeons that have the exact same practice that I do and that love it. They love the breadth of it. So I think it's more about just not wanting to give up what I was doing, and then finding people who are supportive of it.
Love that. And would love to learn a little bit more about your day-to-day. And I know we have some, listeners that are, just starting medical school, trying to figure out kind of what their specialty is. Tell me a little bit more about what you do and what makes you love it.
So I have a practice that's about 50% hand surgery. And it's, I would say my most, it brings surprises every day. You never know what you're going to get. There's things that are common, like carpal tunnel and arthritis. And then there's injuries that occur, knife injuries. Here in Oklahoma, we have roping injuries and oil rig injuries, gunshot wounds. And so I chose the field of the specialization in hand surgery because you get to do everything. You get to do fracture work, you get to do bone, like little kids, congenital, so from little kids to adults, nerves, arteries, tendons. It's really one of the few places where one surgeon does everything. And that's part of the reason I chose the hand surgery. And I like doing something different every day. I like the unexpected and the unknown of it. It does come, like with anything, with its own difficulties, I guess, in the sense that when you're on call, I mean, you can be up all night long operating, and those cases are usually the most fun and the most interesting, but they often, these, gunshot wounds or fireworks injuries, they're always at 1 a.m. They never occur during the day. And so I think that's hard as far as just trying to figure out how you do the rest of your life. But I also have a practice where I do a lot of reconstruction. And so that entails, I guess, like filling holes. So if a dermatologist or a Mohs surgeon, a cancer surgeon has to take out a skin cancer and you get a hole on your cheek or your scalp or your nose, I fix it by doing different things like flaps, skin grafts. I do that all over the body, but I enjoy fixing defects in the face the most. And again, I think it's kind of the same theme. It's never the same. It's never the same surgery. It's never the same defect, which I think is fun, keeps you on your toes day to day. And then I do some cosmetic work, which includes facelifts, tummy tucks, breast augmentation, things like that.
So you do the gamut. I that's so fascinating, and it's interesting to hear about, every day is different. I could see how that would be really, really exciting. What I wanted to ask you is hearing about all of the different, cases that you may have per day sounds, to be really exciting. Is there a piece of, of your work that really makes it rewarding for you?
Um, I think the best part of my job is that it's almost like immediate satisfaction. You break a bone and we can fix it. I think some of the most devastating injuries and, seeing these patients for years, a lot of the ones that have like fireworks injuries, they're devastating injuries. And, to be able to give that person function at the end of these devastating injuries, it may not be what they started with, but after several surgeries, we get them to a hand that is able to continue daily life. I think those are my favorite patients that really I've seen go through. I had a couple young patients who had ATV injuries and lost fingers, and we had to do multiple operations. And I see them through their graduations and through college, and it's really amazing what people do. And these are injuries that at the time can create a lot of difficulty for the patient, but seeing them at the end and seeing how much they've persevered, it's really rewarding.
That sounds incredibly fulfilling to see them on the other side, and from your work be able to live and have a high quality of life. Really quick, just tell, I think awareness is always good on certain topics. Let us know. I mean, it sounds like fireworks are something that, we still have, quite common in this country, especially around our days of, celebration. Tell us a little bit about, what you've seen and what people should be aware of.
Oh, I am happy to do so. To anybody who wants, I share pictures just because I think pictures are worth a million words. Fireworks are very dangerous. The most common types of injuries I see are when people think that they've got a dud firework, it hasn't gone off, they don't douse it with water, they try to pick it up thinking that it just isn't working, and then it explodes. And when I say explodes, I mean it takes fingers completely off. It rips through the hand. They are terrible, high impact injuries. The other types of injuries are with mortar shells and these rockets that they light in their hand purposely, and then they misfire, and then instead of going into the air, they explode in their hands.
The Roman candles.
The Roman candles, yep. And then, so those are the big devastating injuries, but I also see burns, and sparklers are not benign. They go up to 10,000 degrees. And so even the sparks from them, not the actual sparkler themselves, can create terrible burn injuries. And oftentimes, these are little kids running around, and I think they are, what I tell people is you have to always keep a lot of close eye on kids when they have this, and adults sometimes, because they can create terrible burns.
That is a really good PSA for everybody, and I think it's an important topic. I want to shift gears here a little bit. I want to learn and have our audience learn how you really stay up to date with trends and what's latest within obviously your specialty.
I think that one of the most important things is being engaged in learning. Our fields are constantly changing. Some fields kind of more rapidly than others, but within our own community here in Oklahoma, we have a journal club that we meet once a month, and we go over the latest articles. We do that with the fellows here and all the other community hand surgeons, which is awesome because you get kind of perspectives from an academic center, you get a perspective from high volume private practices, you get the fellows in there. We have some retired hand surgeons that come, which is also adds a great perspective to why is this so different than what we did 30 years ago. So things like that. Also taking the time to go to conferences. I just went to the Canadian Plastic Surgery Conference, and I said it this weekend, you never regret going. It is always hard to get out of your work and your surgical schedule and your family commitments. But there's always something to learn for everyone. And so I think just remembering that is worthwhile. And also, I mean, not just for your surgical practice, but I also have a leadership role in our hospital system, and going to conferences, and I've gotten a certificate in surgical leadership, which is a year-long course. It's a Harvard course that teaches you how to be a leader, how to manage people. It has lots of other components, but the other kind of hats that I play in our administration, you never learn how to do any of that in medical school. And so going and being taught by people who this is like that, this is what they do and they do it well, I think has helped a lot in learning how to look at finances for a hospital, for example, and being able to talk with our financial people in the same language. I think there's nothing better than to be able to go and educate yourself on those things.
That's an invaluable tip, I think, for, anyone listening about ways that you've just, stayed ahead of the curve and really continue to educate yourself on things, obviously beyond, what you learn in medical school to help with your leadership position. For those that are interested in maybe, also taking on, leadership role or going on a leader path, how did that come about for you, and what inspired you to take on those roles as well?
I think it started because I like being involved in the decision making. Hospital systems have a lot of moving parts, and oftentimes what comes down, big hospital systems like ours especially, have a lot of layers, and what comes down to you is you have to do it this way, or you can't do that, or we can provide this but not that, and you're left thinking like, well, that's kind of silly because in my head X, Y, or Z makes more sense. But realistically, there's been so much more that has gone into that, and I like not only knowing that, but I like being part of it. And it really started with, and what I encourage everyone to do, with things that really matter to you. For example, I really felt that we could be more efficient with our block time in the operating room, like how time is divvied up between all the surgeons. And I think it makes you as a surgeon more efficient, makes your time more valuable. It also makes the system work better. And so one of the first things that I got involved with is participating in things like block committees. And then, you're involved in one committee and you get asked, do you want to participate in this other committee? And I think that you're not trying to add things to your plate just to add them, but if they interest you, say yes, because then you can figure out, what that committee is all about. And that's really how my leadership role at Mercy kind of escalated to where it is now. And I really enjoy the part of figuring out, if other surgeons are having issues, how we can help them navigate that, whether they've been here for a while or new surgeons, making their lives work better for them and for their patients has really been a good part of my growth at Mercy.
That, that's to me sounds really, fulfilling. And it kind of speaks to the partnership really of, an amazing healthcare system and organization. And then, who, they are employing and working with from, physician, APP level. Kelly, I'd love, obviously you originally recruited, Dr. Gray to work at Mercy. And then, now I know you're working with Mercy and on some, additional searches. Tell us a little bit more about, what makes you passionate about, seeing, stories like this, really.
Well, Sylvia is such a prime example of why I love this profession. We, watching her come to Oklahoma and integrate herself into the community, climb the ranks through Mercy, and the impact that she's had not only on making her own practice hers, but on countless other physicians' practices in her leadership role. It's very fulfilling for me to know that I played a little tiny part,
a big part,
no, a little tiny part in that, and the number of patients that she has seen and made an impact on their lives in Oklahoma. I have so many friends who have seen her and their kids have seen her, and just it's really amazing to be a little part of that. Now that I'm on the side of the Pacific companies, it's really fun to be working together again. So in business development, I get to work with physicians like Dr. Gray and the administration team and the internal recruiters to talk with them about their strategy. When I was working for Mercy, not only was I was a physician recruiter, but I also was an operations manager and helped manage the day-to-day operations of our specialty clinics. So I think it gives me a little bit of a unique perspective from a business development point of view in the physician recruiting world, because most folks don't understand the inner workings of the health system like I do. So now that I'm with Pacific companies, we've had so many awesome conversations about growth strategies and what, even when we have access and insight into market analytics that our clients might not necessarily have, because we're seeing what's happening on a number of levels. And, obviously we work in all 50 states. So being able to help kind of provide some of that, even with Mercy so far, we're working together again. And there's been some conversations that we've had, where Mercy's like, hey, I think this is what we want. And then we're having conversations after the fact. Well, hey, have you considered this or this or this? And maybe you need to be open to looking at other, like maybe a little bit of a broader search or whatever. And we can have these kind of like consultative conversations, which is really fun for me. And it's kind of like all of my worlds coming together. And it's been really, really fun being on the Pacific Companies team and getting to use that experience.
I mean, I really think it's come full circle in the sense that in my leadership role, we talk about growth and strategy very often and what that looks like. And when we're expanding our providers and our footprint, talking about recruiting is so important, and how you recruit, and then having the kind of insight that a big company like this has. It's also interesting to us because we are in 4 different states, but we don't have a presence in the entire country. And so having the ability to recruit that broadly is really helpful for our growth strategies. And then to be able to talk to Callie about what does this look like? How are other people doing this? Like, how are they being successful? I think has been helpful and fun.
Well, I love hearing the story of you guys working together again in a different capacity, and both of you working to solve really what we have is just a healthcare crisis with the shortage of providers, and finding ways to uh, fill those gaps where where we really need providers. So I think I love this to hear this. Callie, quick question for you, for any healthcare system that may be listening. Do you have, kind of one tip or one, kind of strategy you want to just give high level for them to think about a bit?
I would say get ahead of the game. So a lot of times our clients come to us and they're saying, oh my gosh, we've been recruiting for 2 years and we have no candidates. And our only urologist is retiring in 3 months. Help. Well, we are behind the curve at that point, And so I'm always very impressed with our clients who are looking at their growth strategy 18 months out, 3 years out, looking at retirement planning, succession planning. As you mentioned, Stacy, the physician shortage is here. It's real. It's getting harder and harder to find great physicians, and it takes a while to do this. It's sometimes we can place, a physician in a month, but a lot of times it takes longer than that to find exactly what our client is looking for. And so really being proactive in that planning strategy is probably my number one tip. And also my favorite part of the job. So that's my favorite thing to do with our clients.
Love that. Great tips for anybody that's listening. That is, obviously in that position of staffing for their system or hospital group. Dr. Gray, I want to, end things. I want to hear a little bit about, you're such, successful, highly, motivated and disciplined person. I want to hear just, how you really think about this, the thing that may not be real, work-life balance, but tell us a little bit about that.
I think, and I tell my kids this, they're like, gosh, you work a lot, you're going in the middle of the night or you're going so early. And I'd say, if you don't love your job, it is very hard to do it. I do love my job. I love what I do. Sometimes at 2 a.m, it feels not amazing, but I do think, like, when I get there, I'm excited to help the person. So it is, that I think is the first and foremost. And then I do think this work-life balance is a little bit unfair and elusive. I think the idea of you can't have and do it all. I mean, it's just not, there's not enough hours in the day. I delegate a whole bunch of things. I have 2 amazing physician assistants that I work with in my clinic, and they are invaluable. I mean, they help me when I'm running around doing 12 things. I know that they are there doing all the other things that have to get done to make my clinic work. I have a live-in nanny who I am sure is going to be there if I get called at 2 a.m. I'm not worried about what are my children going to do, who is going to be taking care of them. And she's like a consistent person, and she is amazing and also invaluable. I mean, my parents live here. And, all the things that happen at 3 o'clock when the kids get out of school and have to get them to 12 different places, I have a lot of help. And I have a lot of people who love on my children. And, I am also, like we were talking about kind of at the beginning, I have a lot of control of my, so if I want to make it to their, during the day play at 1 o'clock, I block out my schedule and I make that happen. And so even though I have lots of roles, and as you kind of go through your career, you have more say. So like this morning, I needed to meet with another physician, but I had other things to do today, this afternoon, so forth, and so we met before work. And there's a lot of flexibility in life if you make it that way. I said, hey, I can meet you before, let's have a coffee. And so figuring out like when is it maybe less disruptive in your day, and having good friends that help also. We do a lot of community taking care of our children.
Yeah. Well, you do a really great job of prioritizing the things that bring you joy, like the golf lessons with your boys and things like that. Like, she makes the things, time with your friends, like, Dr. Gray, it's weird to call you that, Sylvia, is really, really good at prioritizing her people and delegating the things that don't serve her and bring you joy. You're really good at that.
I think that one of the things that I love, and I think it was Angela Duckworth who said this when I saw her speak. She said, think about having, you have glass balls and you have bouncy balls. The glass ball, you only have 10 glass balls. You can only keep 10 things in the air safely. The rest of them have to be allowed to bounce. So you figure out what those 10 balls are and you do your best to keep them in the air. And the rest of them, sometimes you can juggle them and sometimes you cannot. And I view that as like, I am a terrible cook. I dislike cooking. I will never cook. I go to Callie's house if I want a home cooked meal. And, and that's okay. It's just, you can't do it. It is not one of my glass balls, but my kids are. And so if that means, having to leave work early or, prioritize their games or so forth, that's one of them. And you make it happen.
That is such a great way to end this, to, really focusing on the things, that are important and that bring you joy, and hearing from somebody that is doing it all and so successfully. I want to thank you, Dr. Gray, for your time and for all that you do and for all of the people that you serve and really provide amazing outcomes to. And Callie, thank you for your time and all the perspective that I think will be really, meaningful for the healthcare systems executives or anyone that's listening. So thank you both. And we would be so delighted to have you on at any time. You're both amazing.
Thank you, Stacy. We appreciate your time.
Thank you to all of our listeners. If you would like to be notified when new episodes air, make sure to hit that subscribe button. And a big thank you to Pacific Companies. Without you guys, this podcast would not be possible. If you would like to be a guest, please go to www.pacificcompanies.com. Thank you.